Welcome back to Indiana Newsdesk. Well, around the globe, medical professionals, researchers, and politicians are attempting to find anything that can predict where the next COVID-19 hotspot might emerge. New research married with techniques of the past is providing valuable data to a growing number of cities, including one right here in Indiana. Brock Turner has the story.
With this coronavirus having never before been seen in humans, getting reliable data quickly has been one of the greatest challenges, crippling the response. Researchers from Yale University first discovered a link between swelling infection rates with rising levels of coronavirus in municipal wastewater plants. Growing levels in samples correlated with rising infection rates.
We didn't know that we were able to capture that until, about halfway through the outbreak in our town. And then, I would think it was a pleasant surprise. I mean, certainly we had a hypothesis that it could track it, but I'm not sure how hopeful we were.
Carmel, a wealthy suburb just north of Indianapolis, is part of a growing collection of cities testing wastewater for coronavirus.
If we were to see a surge in the wastewater, first of all, we can alert the hospitals and they can plan for it. Secondly, we can take major measures if necessary to go backwards in our reopening plan. I hope that we don't have to do that, but if data indicates we need to, we would.
John Duffy is the director of utilities for the city of Carmel. He says small amounts of virus, along with numerous others, are found in wastewater. While the models used to analyze the results are difficult to precisely calculate, labs are zeroing in on the right approach. For decades, cities have been testing their wastewater for a number of diseases and substances. Carmel and many other cities employ chemists to help ensure the water being returned to the White River is cleaner than it was when it was taken. Duffy says testing is relatively inexpensive and easy for a facility to implement.
A lot of people think the same way. Everybody also understands that it's ever evolving, but if you don't, the virus is here now. It's time to start, to try.
Currently, Carmel is not experiencing an outbreak, but the city hopes to get a baseline of the virus to begin a deeper analysis. Experts say this type of testing is a leading indicator.
When you first get sick, you can shed the virus, and we'll see it in treatment plants. But most testing, or certainly prior to now, has been prompted by symptoms. And so that takes a delay 7-8 days. And so we're still running 7 or 8 days above in front of our testing data.
Eventually, Carmel hopes to test wastewater in specific areas, like large office buildings or nursing homes, to isolate where an outbreak is occurring. This could stem an outbreak before it begins and provide significant advantages over the current model of waiting for nasal swabs.
Being able to see exactly where in the city it is would be an extremely valuable tool. If it's coming out of one office building and that's where the surge is, then we have other tools we can use. We can go test everybody in that office building, identify who has it, quarantine them, do contact tracing to see who they were around.
Duffy says the samples are easy to collect and relatively inexpensive to process.
Certainly the intent is to get samples back as quickly as possible so you can start seeing data. Ideally, a couple weeks ahead of others even knowing they're infected.
City officials say lab capacity is the greatest challenge. The Boston-based lab Carmel was initially working with wasn't able to get results back quickly enough. Now, the city is working with labs at the University of Notre Dame and NASA. While this testing will surely continue to evolve, everyone agrees sampling these facilities doesn't replace aggressively testing sick people or contact tracing. Instead, it offers valuable lead time for decision makers desperate for data to inform their decisions. Quite simply, it could help protect the most vulnerable populations and even save lives. For Indiana Newsdesk, I'm Brock Turner.